Hello again, this is Dr. D of CosmeticSurgeryTruth.com. Today we're going to talk about scar treatment, or specifically scar revision. Some scars are actually best treated, in my opinion of course, by a simple operation called scar revision. The nice thing about scar revision is it's relatively simple. It does involve a small operation, depending on the size of the scar. Some of these operations can be performed under just local in the office, which is numbing shots. But the nice thing about scar revision is if you choose the right scar, the potential for improvement is quite good. You have to choose the scar correctly for the surgery, and it has to be done right. You can't cut corners with materials in scar revisions, or you're going to end up with either no improvement or relatively little improvement. We're going to look at a couple of examples of people I've treated, some of whom I've treated with very short follow-up periods, and they already look better. In general, scar revision takes time. The improvement you see immediately is good, but the improvement you see over months to a year is actually much better. And the reason is, when done properly, scar revision takes advantage of the way your body heals to allow improvement. So let's look at a couple of these examples. Here's a picture of a gentleman who had skin graft donor sites in both groins, which ultimately became darkly pigmented and wide. These are specifically good candidates for scar revision. And within a couple of weeks, the second picture here is the one on the right having been treated a month prior. He's got a nice improvement. He still has some stitches dissolving under the skin and things, but there were no stitches in the skin, and this was all accomplished with one operation. He's just now starting to use silicone sheeting, which we'll talk about later, that actually helps the scar revision heal better over time. I think it helps them mature quicker. This second example is an example of a lady I treated many years ago. She had a muffler burn on her calf, and she'd done all kinds of different treatments and various other things for this, and she had a very wide, pale scar, which is actually very amenable to revision. And you're going to see her picture pre-op, and it's marked, so you're seeing the portion of the scar I was specifically looking to remove. Then you're going to see a picture at 6 days where the scar is less wide, but it's kind of heaped up and irregular. That's just the early support by the sutures that shows a little bit of irregularity that sometimes alarms some people. It alarmed a lady I did a revision on not long ago. You just have to wait through this. And at 3 months, the wound looks pretty good. It's a whole lot better. That heaped up appearance at 6 days is gone, and really she was actually quite pleased. We ended up revising the rest of her leg scar at another sitting a year or two later. A third example is a lady I took care of a number of years ago with a very wide scar on her thigh. You see that the width of the scar has been altered, and the normal, regular, healthy tissue has been brought together. And that's the key of a scar revision. It takes the irregular, scarred thing out of the picture and puts in its place the healthy tissue from next door. So hopefully this will be helpful in those people in whom a scar revision might be the answer to what they've been seeking. Thank you very much.
CosmeticSurgeryTruth.com. You would have to be crazy, crazy, crazy to go anywhere else.